the next step, I guess I would ask, the next question I would ask is because I've heard a lot on the internet and other places about beta glucan and cancer, because that's obviously the one thing that people are really concerned about, trying to find a way to help with that particular disease. So if somebody is already under a doctor's care with chemotherapy or radiation, what effects would they have from beta glucan? Is it safe to take under those conditions?
Well, it's surely safe because first of all, we have to remember that almost every anti-cancer drug is toxic to begin with. So we cannot make it any worse than it already is. But glucan can help patients with cancer in 3 different ways. One is it helps to take away the side effects of the chemotherapeutic drugs or irradiation. And we know that quite well because the original studies on glucan were really done on irradiation or chemotherapeutic damage of bone marrow. Basically, the people irradiated mice with a heavy dose or with a lethal dose. And they're feeding them or injecting the mice with glucan and found out that they survive. Basically, most of the irradiation or chemotherapy effects are destroying bone marrow. So meaning that the bone marrow doesn't produce the cells, and we got anemic, and we have no cells to fight infection. Glucan strongly stimulates the bone marrow. They produce much faster, much stronger. It can go back in, let's say, a week instead of 2 months. So you might not even lose hair without chemotherapy and stuff like that. So it helps to get rid of the side effects. It's not curing, but it's helping. Other help is the stronger immune system is helping to fight cancer. It might be not enough, but again, it's another step, another help. And with cancer, trust me, you need
all you can get.
Yeah,
sure.
Exactly.
And I saw there's a video out online talking about the process of beta glucan, how it works. It shows the Peyer's patches and that process. And one of the things it mentions is that beta glucan helps, I believe it's neutrophils, if I'm not mistaken, that don't normally see cancer, and it kind of turns them on to be able to see cancer as non-self, which is huge. So that's very exciting.
Yeah, and another point, and this is just something which both the clinicians and the scientists are studying last, let's say, 3, 4, 5 years, is just to use glucan together with anti-tumor antibodies. That's a type of treatment which is really new. The monoclonal antibodies against cancer are known in practice, in medical practice, for, let's say, 5 years, and they're starting to be used heavily. But they still are not 100% guarantee for the success. But if they are done and used together with glucan, they are suddenly 2 times, 3 times more active and more successful than alone. Either the antibodies or the glucan alone. They work together.
Well, that's exciting.
It is. It is.
It gives us a new option in that area. So